Hello, my name is Jason Bolt. I am a CRNA in training, and I would like to take a few moments today to talk to you about what a CRNA is and how they may interact with you in your life. You may never have even heard of what a CRNA is, so I'll explain it to you. A CRNA is a Certified Registered Nurse Anesthetist. Sometimes they're called nurse anesthetists, sometimes they're called nurse anesthesiologists, but they all come back to the same root of being a CRNA. CRNAs have been around for over 150 years. They began their origins during the Civil War when men and soldiers were dying on the field and surgeons couldn't keep people alive long enough to get their procedure done. So nurses stepped up and they went through training and education and said, we're going to provide anesthesia for these people so that we can save their lives. All the way up until today, CRNAs are still on the front lines at forward operating bases in the military, providing anesthesia for our soldiers, and all the way back home to our civilian hospitals here in rural and metropolitan settings. CRNAs are on the front lines of healthcare, providing anesthesia for you and your family. They provide more than 45 million anesthetics per year, and there are over 50,000 of them in the United States. So chances are, if you've had any surgery in the United States, you have had a CRNA providing that anesthetic. CRNAs sometimes work in teams with other anesthesia providers, like our colleague, the physician anesthesiologist. Other times they work independent in CRNA-only practices out in more rural settings or even metropolitan settings. And there are some CRNAs that do solo practice, like in a dentist's office, where they're the one and only provider there taking care of providing anesthesia for patients who need dental sedation. To become a CRNA, you first have to have your Bachelor's of Science in Nursing. And then you have to work a few years in a critical care unit, taking care of very sick patients, where you really have to use a lot of your critical thinking skills to keep people alive and deal with advanced pathophysiology. After you've finished your time in the ICU, you'll then be able to apply for CRNA school, which in the past was a master's program, but is now currently a doctoral program. During CRNA school, you learn all different aspects of anesthesia, and you go through clinical rotations and rigorous didactic education to inform you on all the medical knowledge that you need to have to be a safe, full practice anesthesia provider. That's just some quick facts about CRNAs. Now let's get into seeing what the daily life of a CRNA is like and how that may affect you as the patient. First up is Dr. Brian Foster. He's a CRNA who works in a rural hospital providing anesthetics for patients every day. He's agreed to allow us to follow him around and see his daily process from when he first meets the patient to taking them back and providing the anesthesia to then waking them up and then taking them on to the recovery room where they'll be monitored. So let's get into that.
Brian Foster, I'm a nurse anesthetist. I'll be back here with you while you're asleep. Just have some medical questions to ask you. Is it okay for me to ask them for your family? Of course. All right, buddy. I'm going to get you off to sleep, okay? Medicine may feel a little cold going up your arm. That's normal. This next medicine may feel a little warm going up your arm. That's normal. This is the sleepy medicine, okay? You're going to get real sleepy real quick. There's a lot of people in this room watching that after we're going to take excellent care of you, okay? put it in. Hey buddy, all right, we're all done with the surgery. You did great. Take a big deep breath for me. Big deep breath. I'm going to get you to recovery room now, okay?
Hey there. Hi.
Hey, this is Adam Miller. He's a 27-year-old male. History significant for hypertension, childhood asthma. He had a right total knee arthroplasty done today. He got a total of 200 mics of fentanyl, 30 of Toradol, gram of acetaminophen. No problems with the procedure. We'll lock this bed. All right, buddy, we are in the recovery room, okay? You'll be here for a little while till they make sure that you wake up good, and then you can see your family, all right?
My name is Jane. They've been taking good care of you, and now it's my turn, okay?
I think whether it be making somebody laugh and smile or giving somebody a medication that occupies opioid receptors, getting to make somebody feel better or not feel at all when they're hurting is probably the most rewarding thing. Seeing the look of anguish fade into comfort is the most rewarding thing about being a CRNA.
I believe the most difficult thing in being in CRNA school is just having to change your lifestyle a little bit. You know, you get used to making your money, working in the ICU, being on top of your game, and then you go to anesthesia school where you're essentially starting from the bottom and building your way back up. And having to adjust to studying, having to adjust to going to clinicals and working with all types of different people and being that student again, it's pretty difficult.
I certainly feel that CRNAs work in both in an anesthesia care team model or independently. Evidence shows that effectiveness, they're just as effective in either scenario. Certainly there are pros and cons to each. In the independent scenario, CRNAs get to fill a vital role, especially in rural communities, in underserved communities, in communities where they really need anesthesia services performed, and there's just not an anesthesiologist there. CRNAs do an amazing job of very safely, very professionally, with so much expertise, providing a service for their community. With the anesthesia care team model, I think it certainly doesn't hurt to have another set of eyes on the patient. Working with our anesthesiologist colleagues, for me, in my experience, has always been very pleasurable. It's been an honor. I've always been treated with respect.
I feel very prepared. My program has put a lot of effort into ensuring myself as well as my future colleagues are ready to take on everything that anesthesia has to offer. I think
the doctorate as the entry level into practice for all nursing specialties is an important step in ensuring our future. It tells the community that we've reached a certain level of education, that we are continuing evaluating that level of education. The CRNAs that I've worked with, certificate CRNAs, CRNAs with master's degree, bachelor's degrees, master's degrees, they're all amazing CRNAs. This just is keeping with the future and being able to demonstrate to the people that we serve that we are expecting the highest level of preparedness for the new CRNAs so that we can practice at the same level as the CRNAs that have been practicing for years.
Now that you've got a chance to see what the typical CRNA is doing in the operating room, let's take a step outside of the operating room and see what they do in areas like labor and delivery. Let's catch up with Professor Dawn Wybrew, who's going to be putting in a labor epidural for a patient in the L&D department.
Good morning. Good morning. My name is Dawn. I'm going to be your CRNA that's going to put in your epidural. What's your name?
I'm Catherine.
Hi, Catherine. And I'm guessing you want an epidural today?
Yes.
We have a boy or a girl? Do we know?
A girl.
Excellent. I've looked at your medical records. Do you have any questions for me about your epidural at all? The next thing you're gonna feel is a lot of pressure, okay? So you're gonna feel my thumb on your back, and then you're just gonna feel me pushing along. Providing anesthesia to OB patients, in my opinion, is special because you're not only providing anesthesia for mom, you're assisting in delivery of that new life. And in anesthesia, majority of the time, we're just providing anesthesia for one person. And in the situation of OB, you're taking care of two patients, whether that just be an epidural for pain control or it be an emergent situation for C-section. You've got two patients to take care of, and both obviously want a good outcome. So it's challenging as a provider, but also very rewarding as a provider. And I think that's what makes it different than any other type of anesthesia that you can possibly do. In the Army as a CRNA, the job you do is very similar in the fact that you're putting people to sleep, waking people up. The difference is who you're taking care of. On a day-to-day basis in the operating room in the civilian world, majority of the time you're not taking care of anyone you know. When you're a soldier, you're possibly taking care of your battle buddy or that person that has been a huge influence in your career. So the difference is the camaraderie that you have with all your fellow soldiers in that OR. You're not only associates in medicine, but you're a family of soldiers. So you're taking care of your family. And often these are folks that have been very healthy people, they're in the military, and now something very catastrophic has occurred. So I consider it a privilege and an honor to take care of my fellow soldiers, and that's what makes it different. I think what's nice about a CRNA only practice is that you very much have to work as a team. Although an ACT model is a team, in a CRNA only practice, your fellow CRNAs are your go-to. If you're having difficulties, if you have something you're unsure of, you look to that fellow CRNA. You don't call someone else that is in a different type of practice than you're in. And to me, that's very important. It's also a time where you're able to use all your skills because your entire scope of practice is necessary to take care of that patient. Where in an ACT model, there may be certain skills one group does and certain skills another group does. If you're in a CRNA only practice, you're the one doing all those skills. So it keeps you up to date, keeps you well skilled in everything that you do. Being deployed as an Army CRNA, the main differences are obviously the comforts at home are often not there. I particularly am a part of a forward surgical team, which means we're in a tent hospital. That OR is usually 2 OR beds, and there may be 2 surgeries occurring simultaneously, and our job is to basically stop the major life threats and get that patient further down the line where they can be cared for. You know specifically you're saving lives in that situation because the reason they've been brought to you is they wouldn't make it to that further point. So deployed medicine is very somewhat, I would think, people think it is quick and dirty, but it's not. It is very efficient, very practical, and very necessary for the difference in life and death for that soldier at that time. You have to be able to work under a very austere environment, and you also have to be able to maybe work with things that you wouldn't normally have in the States. But that's where your skills come into play, and I think as CRNAs, we shine. Especially in the military, because 99% of all anesthetics in the field in the military are provided by CRNAs.
Up next, we've got Dina Valachi. She is a CRNA who also serves as the Vice President of the American Association of Nurse Anesthetists. She'll give us a little bit of a different perspective of what a CRNA does outside of the hospital and outside of patient care. While she does take care of patients still and keeps her skills up, she also serves in administrative roles and political roles and patient advocate roles. So let's talk to her a little bit about that now.
Well, I became a nurse anesthetist in 2004, and I worked at a major medical academic institution for a number of years. As well, at the time, I also worked independently in the rural area, and I taught. Through those years working that, I ended up transitioning to the rural area in Tennessee. I cover a hospital at night that covers the 17-county area. Recently, I actually ran for the American Association of Nurse Anesthetists as a Region 2 director, and currently now I am the Vice President of the American Association of Nurse Anesthetists. So the role of any role on the American Association of Nurse Anesthetists, you are a representative of 56,000 nurse anesthetists as well as student nurse anesthetists across the country. Depending on the role that you're in, as vice president, you're more in the communications aspect of things. You're on the executive committee. But all in all, we are all an equal voice on the board. And it is about basically promoting and protecting and advocating the profession of nurse anesthetist. And one of the biggest things will be going out and defining ourselves. Instead of letting others define us, we're going to define who CRNAs are in America. Politics is in all our lives. It's in every aspect of it. And of course, it's going to be in anesthesia. And the biggest thing where I could say where politics is involved is always where we have to fight for our practice rights. It would be very simple if you look at the economics of things. There would be no question we should have full scope of practice. We make sense. We're an awesome solution. Not only the number of providers we have and a workforce, but also in the economics behind it. It's a compelling story. It's a solid story. However, because we are a trade association fighting with another trade association for the same market share, what ends up happening is who has the political capital, who's got the money to fight for you on the legislative level. And that's where we always struggle. We've been here, we've been doing the job, we're safe. They can't say that our safety's not there. They can't say that we're not cost effective. We are. But the problem is it comes down to the politics. So it's very, very key to why or how successful we can be as an association and how well we're allowed to deliver the care we can deliver. Taking care of the opioid crisis, we have a great solution to do that, but we are going up against barriers because we are CRNAs and we're competing. For us at the AANA, and I can speak for the board, I'm pretty sure I can at least speak for myself, is that we're in a time and an age that now we need to define ourselves. We've allowed too many other people to define us, and it's time that we come out and really just speak the truth. It's not putting a story or this to it. It's really just speaking the truth of who and what we are and what we provide. And instead of keeping us the best kept secret, I would love to make, and I know the association would love to make CRNAs a household name. It needs to be where everybody can say, just like a nurse practitioner, oh, I know what a nurse practitioner, they should say, oh, I know what a CRNA is. You know, they would have an understanding of not just who we are, what we are, but they understand the impact that we provide and give them access to their care. So that would be our goal going forward, is changing what they're saying, and actually we define, we speak for ourselves, and we control the conversation and say, no, this is what CRNAs are, this is what we provide in America, and this is what we can do, and this is where we can help, and that we're actually a solution to the problems of healthcare.
Well, all right. Now we've had a chance to talk to 3 different CRNAs, and we've got to see different perspectives of the operating room, labor and delivery, administrative and politics, and those are just some of the areas that CRNAs serve in. They also are educators, they are also business leaders. So I hope through these clips today, you've been able to learn more about what a CRNA is and what they do. And the next time you go in to have surgery, just know that when they come into your room and say they're from anesthesia, they're probably a CRNA. Strike up a conversation with them and they will be glad that you did.
Mic check, mic check.
I hope it's working.
Now I'm nervous. It's hard being on this seat. Good evening. Reporting live from the OR, Mia Moore, SRNA. What you're about to witness is something special and miraculous.
You're talking.
Yeah, I don't know what else. Yeah, I do feel prepared.
Do you feel well?
Hey, we in there now! Can I name drop? My hope is to continue to mature in anesthesia, as well as.
That
was too much.
We gonna cut this out. I mean, like, what's your career goal? Not like your personal inspirations.
Can I get an amen?
The ultrasound.
Baby, I'm not you. I'll let you.
Or what's
What we're going to do is, my name is Brian Foster. I'm a nurse anesthetist in Jackson, Tennessee, and this is the future of anesthesia.
let's lay hands on him.
And these are the people that make my job worth doing. Now, what shall I say? What shall I say?
You're inspired by us.
The best part of anesthesia is who you get to do it with and who you get the pleasure of teaching. You're gonna what?
I said I'm gonna delete all that.
Oh, no, you don't like it.
No, it's good. It's good.